I'm going to go ahead and click start streaming. All right, we should be live now. Hello, everyone, and welcome to another Dental Shadowers Virtual Shadowing session. Today, we're joined by Dr. Vu, who is an orthodontist, and she has prepared a great presentation for us. So, Dr. Vu, whenever you're ready, you can take it away.
Okay, hi, everyone. Dr. Tao Vu. I'm an orthodontist, like she said, and I'll just go ahead and jump right in. Oh, did I do something wrong? Hold on, let me see. Do you guys hear that? Am I supposed to? Oh, here it goes. Okay. Oh. I just have to click my mouse. Okay, so I am a practice owner in Long Beach, California. I've been a practice owner since 2014. And since I graduated in 2013, that means I kind of jumped right into practice ownership, almost right out of school. And I am currently in the works of constructing a second location from scratch in Garden Grove, where I grew up. In addition to being a practice owner, I do teach part-time at my alma mater as a clinical faculty at USC Orthodontics. Let's see here. So what is orthodontics? I'm sure you've kind of understand just the basics of it. It's basically a specialty of dentistry that deals with the diagnosis, prevention, correction of malpositioned teeth and jaws and misaligned bite patterns. It can also focus on modifying facial growth, especially in teenagers and young and adolescent kids. Orthodontics was actually the first dental specialty in 1900, and Edward Angle, who is considered the father of modern orthodontics, he was trained as a general dentist, but he decided to focus his practice primarily on orthodontics. Okay. So my personal journey to becoming an orthodontist, I, like most kids, had braces when I was a teenager. I had 4 teeth extracted as part of my treatment, and that was my first exposure to orthodontics. And I was kind of intrigued. I thought it was really neat to be able to kind of change someone's smile for the better, be able to change how they view themselves and gain confidence. And so from there, I was kind of, looking into orthodontics as a career. So when I went to UCI as a biology major, I was pretty sure I was at least a pre-dental student. While I was there, in addition to taking my college courses, I took classes at a vocational school nearby to become a certified dental assistant. And by being a certified dental assistant, I was able to work in a dental office, a few hours a week to get some experience in the dental field. And I really encourage that. I think that's a great way to really get hands-on instead of just, interning or just kind of shadowing someone. If you have the time to do it, I think it's a great way. So I got into UCLA Dental School, which was my first choice, and I remember thinking I was just like so intimidated by a lot of my students. That they were like crazy smart. People were also coming from all sorts of awesome backgrounds, and I think like in my first 2 years of dental school, I was really thinking maybe I shouldn't pursue orthodontics. I don't think I'm competitive enough, and I guess after taking my board exam, my score was competitive enough. I decided to go ahead and just try it out and apply. And a lot of students, dental students at the time who applied to residency, they would apply to like multiple programs, get like 5, 6, 7 interviews, and here I was just like 2 interviews, and I got matched to my number 1 choice, which is USC. And so I think that's something I'll circle back to as far as to kind of don't be intimidated by your classmates. Everybody has their own path, and just focus on yours. Don't get distracted by anybody else's, and do what you want to do, and don't be living in fear of failing, essentially. So to go into my daily routine, I typically in my practice see about 30 to 40 patients a day. Here is a screenshot of my schedule for Thursday. And you kind of see my practice is usually lighter in the morning because of, patients are either at school or at work. And in the afternoon is a little bit busier. We have the after school rush. So typically I try to do is schedule the longer appointments in the morning. For example, removing the braces, applying braces, work appointments. We'll do that in the morning if possible. And then we'll reserve the afternoon appointments for the patients who are coming out of school. I quickly ran a report. My practice is about 57% braces, 38% aligners, and 5% lingual braces. And I feel that my aligner cases is increasing faster than my braces cases. So you'll start to see, I would probably wouldn't be surprised if at the end of the year my aligner cases were like 50%. So in between seeing patients and during my lunchtime, I'm often doing digital setups for aligners, emailing referring doctors, and doing sometimes virtual checkups with my patients. So this is kind of neat. Orthodontics in the COVID era. I find myself, since we reopened in May of last year, I'm doing a lot more virtual exams, virtual appointments through Zoom. More patients who are starting aligners because that's something that's easier to do without having a lot of in-person visits. And also treatment monitoring through video photos. And this is an example of a video my patient sent me using the virtual monitoring software that we're using. Let me see if I can play it here. So this is basically a attachment to his phone. And so he can record his teeth with his trays in, and for me to be able to see clearly, how the trays are fitting. And I thought that was really neat. This was not available last 2 years ago. And so I feel like there's been a lot of innovative changes to orthodontics as far as being able to monitor our patients from virtually. So yeah, this patient just moved out of state, and so we were kind of, well, let's try this out, see if it works, and so far it's been good. So I think it's very important. Orthodontics is constantly changing, and we need to adapt to the needs of our patients. So it's no longer just like braces and wires, and now patients are requesting, very fewer visits in between in the office, or more aesthetic options and things like that. So I think it's really good to be at, kind of can't think of the word, sorry, to be flexible. Go ahead and go. Okay, so what kind of complaints do patients come in with? I hear, crooked teeth, a crooked smile, difficulty chewing, TMJ, unhappy with facial appearance. And this one's new. I see myself on Zoom all day, and I hate the way my teeth look. And I literally, in the last 2-3 weeks, have had several patients come in with that teeth complaint. And so I think it's really interesting. So there's that. So what kind of procedures do orthodontists perform? We typically align teeth. We collect bites. Sometimes teeth are impacted, meaning that they aren't able to come in on their own. So we'll coordinate with an oral surgeon to expose the tooth, and by using braces, we'll be able to manually pull in those teeth. We can prepare the arches for eruption of permanent teeth. And sometimes there are multidisciplinary cases, as for example, orthodontics combined with orthodontic surgery, or we can prepare the teeth for restorative work. Okay, here are some diagnostic tests, the records that we normally use. On the left-hand side, you'll see this is what we call a lateral ceph, and from there we typically will take measurements and angles to determine whether something is within normal or if it's out of the range of normal. And then on this right side here, we have a digital model. So in my office now, we rarely do those alternate impressions. So, being able to offer this to our patients, it's been great. It just makes the patient experience so much better. And I actually prefer to have these digital models now because it's just so easy for the computer to generate like the cruise, like how the bite fits together, and I think that I'm able to get more data out of it than just a regular model. On the bottom right here, we have what we call a panoramic X-ray, and basically kind of shows all the teeth, erupted and non-erupted, and you can also see the condyles, and if there's any impacted teeth, you can almost see right here, this patient had 2 impacted teeth, one like sitting below the lower incisors and one sitting in the palate right here. Okay. So what other new technologies are in orthodontics? One of my favorite current technology is a treatment stimulation done by the iTero scanner. Again, what we do is we scan the teeth and create a digital model. And from there, we're able to simulate how the teeth can look like once the treatment is done. And I usually do this at the exam appointment, and to be able to show my patients the before and after, before they even start, is great. It has it just motivates the patients to really pursue treatment. Other things that I'm using in my office, I do 3D print models. So from these digital models, where I'm able to 3D print the models, and from using those 3D printed models, I can fabricate their retainers. So the accuracy of the retainer fit is so much better than, again, the plaster models we used to take. Some other new technology that we use now is customized brackets and wires for patients. In the past, we've always used what we call stock brackets or stock wires, where everybody has the same brackets and wires, and the orthodontist would have to bend the wires to customize the movements of the teeth. These days, with the digitization of like everything, we're able to either have customized brackets and just put in a straight wire, or we can have stock brackets and put in a customized wire. So an example of that is InBrace. So InBrace here is the Lingua Braces that you see. How this technology works is that the brackets themselves are stock brackets, but they are precisely placed on the back side of the teeth, and the wires are actually customized wires. And so this wire is meant specifically for this patient, so to move the teeth in a certain way. And so it's not, you can't interchange this wire with another patient. So this is an example of what they call like a smart wire, a customized wire. And so this is relatively new technology, and some of my patients who can't handle aligners love this type of technology because this is really invisible. They don't have to worry about taking their aligners in and out of the mouth all day. And with the smart wire, it's the programming is already in the wire, so we don't have to switch out lots and lots of wires. Typically, in an InBrace case like this, we'll have maybe 2 or even 3 wires at the most for the entire treatment. So we don't have to see the patient once every 4 weeks. We usually see the patient once every 2 months even. So this is really cool new appliance that we're using in the office. Another new technology that I use is what we call mini implants, aka temporary anchorage devices. And this is not super new, but I would say it's new within the last 20 years or so. And we use these mini implants to be able to move the teeth in a way where that braces by themselves couldn't do before. And in my first case, I'll show you how we do that. Okay, so moving on. So this is the first case. This patient has had braces before, and so you can see that her teeth are, relatively straight. Her bite fits well together, but her main concern was that when she smiles, she shows a lot of gum, and this is what you would consider a gummy smile. And patients who typically have a lot of gum show are kind of very self-conscious about how big and how expressive they are when they smile, and that's something that she didn't like and wanted to see if there was any way to correct it. So right now it's a little covered, but I think, I don't know if you'll be able to see on the profile view of the patient, her profile is a little bit flat, meaning that there's no like curvature to her lips. Her lip tissue is a little bit thin. So how do we, this is another close-up view of her smile. Here you can kind of see how much gum tissue she's showing. We consider 2 to 3 millimeters something within normal, useful. Anything beyond that, it becomes a little bit more noticeable, and patients don't typically like that. In this lateral shaft, you can kind of see here that her upper incisors right here is very vertical. It's very upright. Your lips are supported by your teeth, and so if your teeth are a certain angle, they don't give the support, your lips the support they need. So that's why her upper lip it just looks very, very thin. So in the past, to correct a gummy smile, a lot of times surgery was involved. You can either do one of two things. You can either remove some gum tissue from the teeth to expose more of the crown, or you would move the entire upper jaw more superior, so that way everything is less visible, or the gum is less visible when you smile. These days, with the usage of mini implants, we can actually use these as an anchor to pull everything up. And so you can kind of see here the placement of the mini implants is beyond the what she shows when she smiles. So I usually try to place them like as high as possible, so that when she fully smiles, you don't really see them. And you can either use 2 mini implants in the anterior region, or you can use 2 in the front and 2 in the posterior, depending on how gummy she is. Some people are gummy like from the very back to the very front, or some people are just gummy in the front. And if they're just gummy in the front, then all you need is 2 mini implants on top. Okay. So this is her now fully smiling. Kind of see the difference in how much gum she shows here. She shows about 1 millimeter of gum. I actually wanted to stop sooner than this, but because she's so against showing any sort of gum when she smiles, that we went a little bit beyond that. And typically, as we get older, we actually show less and less gum as when we smile. And so you don't want to completely remove any sort of gum tissue when you're smiling, because it just kind of ages you. But what we did was basically, use the mini implants, pull the teeth up, and not only that, I changed the angulation of her upper incisors. Before they were much more upright, and now they have a little bit more of a proclined angle to them. So this again kind of goes over how I changed the angulation of her teeth. So here, when they're upright, you can see that the lip is just it just drapes. There's no curvature to it. But as soon as I change the angle of her upper teeth, then you can kind of see there's a little bit more curvature to her upper lip, and I think it looks much more relaxed and youthful. So I love these type of profile changes. It's what excites me about my career, my profession, is not only just moving teeth, but to also balance someone's face and harmonize their profile and things like that. So these are my favorite cases to do. Okay, so case number 2, along the same lines of facial balance. This patient had been in treatment for 2 years, and her next appointment was supposed to be to remove her braces. And though you can see that her teeth are nice and straight, she just has a very full look to her teeth. They look very flared forward, and so in orthodontics is I feel like it really is such an artistic career. It really is so subjective. You can really position the teeth anywhere you want, and it comes down to the eye of the orthodontist. And so for me, I think her profile was just too full. So what we ended up doing was taking out 4 premolars and to retract her incisors and to pull them back. Go ahead. You can kind of see now the profile change in her. So before she was just very what we call convex. And once we retracted her incisors, uprighted her teeth, then you can see that her profile is a little bit more, to me, balanced, and you can see more of her, the curvature of her chin. She has a really nice chin, but it was kind of overshadowed or overpowered by her lips before. And even from the front view, you can kind of see her lips didn't have much shape. They were just very full. But once we retracted the teeth, then her lips have a much more, I think, a much better like shaped lips. And it did have to, I mean, this is what I really hate to do transfer cases. You know, when someone's already been in treatment for 2 years, but like in a case like this, you can understand why they had to get a second opinion. It was just, yeah, it's just hard to kind of, you know, judge anybody else's work. But all you can do is, well, you know, I think you would your profile could improve with, you know, extractions of teeth, and so she decided, you know, it did take me almost, I feel like almost 2 years to do this. So for someone to go through treatment 2 years already and then just do another 2 years, it's really hard. And but I think that the results were worth it. And it's not often that I get to show a case where someone, you know, profile changed so drastically. It was only because, you know, she had gone one direction and then completely, you know, 180 and did a different type of treatment. So so for case number 3, I didn't show the facial pictures, but you just have to trust me that the face is balanced, and all I want to do is move the teeth here. And this is a case where the patient, you know, wanted an aesthetic treatment option, but didn't want aligners, and so he was really interested in the Lingua Braces. And looking at his teeth, you can kind of see that he has a pretty nice posterior bite. Everything is sort of socked in. There's looking at the bird's eye view of the top teeth, it's a little bit crowded, not bad, but the lowers is what we consider more moderately crowded. He has a cross bite of this premolar here, but overall, like not a terrible bite or smile. So I bonded in-brace on him, and you can kind of see here, this is the progress. This is about a year into treatment. The braces go on, and the wires you just let them cook, basically. That's what I used to say, is you place them and the wires just like automatically start to move the teeth in the right direction. And I have to say that I always prep my patients, like that first month of in-braces is brutal. Like your tongue is gonna be playing with the appliance, it's gonna be cutting up your tongue. So you kind of prep them for, like, you know, lower their expectations. And once they get past that first month and they start to see the movement of the teeth, and then they get motivated and they get really excited that the appliance is working and it's completely invisible. So yeah, so this is about a year to treatment. It ended up taking up a little bit longer than I expected because of COVID. We were supposed to debond before quarantine, and because of quarantine, even after that, we were trying to minimize all the procedures, the aerosol procedures for like debonding, and so it took a little bit longer. But I think that the results is you know, really really amazing. I'm still to this day, even though I've done, you know, several in-brace cases, I'm always impressed with how efficient and the appliances. A lot of times when we do like regular braces, metal braces and stock wires, as soon as we put the braces on, the wires start to move the teeth, sometimes in a way that we don't intend to. There's always side effects, like everything starts to move. And so a lot of times we spend a lot of time undoing those side effects. A lot of these customized braces and wires, the movements are much more direct and efficient. And I find that it does decrease the treatment time, because now we can isolate certain movements, whereas before it's just everything's so smooth. here's specifically this tooth, pull it down, et cetera, et cetera. Same thing with aligners, Invisalign or other aligners. We can kind of dictate how the teeth move and be much more, precise in our movement. And so I've been loving Embrace, aligners, things like that, especially for my adult patients who just want to be in our treatment as soon as possible. Okay. So I kind of went through my PowerPoint really fast, but hopefully that gives us more time to answer questions and whatnot. So my advice for college, dentistry is a profession, but it shouldn't be your life. I hope that you guys explore other interests outside of dentistry. College is a great time to be doing that, because once you are in dental school, you'll find it hard to be, have any time outside of dental school to be pursuing other interests. So, if you like to travel or you like to cook, take other courses. Honestly, I think as a faculty, we love to see people who have interests outside of dentistry, just some things, to be able to talk about with our co-residents or colleagues other than dentistry. I mean, being like so one-dimensional can kind of be boring. That's what I'm trying to say. So, spend this time to be more well-rounded. Be present, enjoy your current opportunities. Look for things to do that you may not get a chance to do later on. One of the things I loved to do, I really was grateful that I had the opportunity to do, was to travel while I was at UCI. I took a summer course in England, and even though I crammed a whole year's worth of OChem in one summer, it was a great experience to be able to do that, because as much as you love traveling, as you get older, sometimes you won't have that time to travel. So I know right now it's hard with everything going on, but even just like road trips, it doesn't have to be foreign. It could just be, an hour or 2 hours away. Even now, I have a hard time finding that time to travel, because I have, my practice, I have kids. And so, so that would be my recommendation. Study for the DAT and do the best you can. Don't beat yourself up if you don't get the best score. I remember my PAT was under 20. It was like 19. I was like, oh my gosh, I won't be able to get into the school I want to, because my score is either average or below average. I would recommend for you to apply to as many schools as you can, ones that are out of your reach, and also ones that you think that you might be able to get in. That way you have choices. Don't just pick 2 or 3 that you really, really want to get into. I think it's best to kind of just apply everywhere. And then once you get a chance to interview, then you can kind of see, how the setting is, how the city or the environment is, and you might change your mind. But you want to give yourself as many options as possible when you're applying to dental school. Okay. And then lastly, again, this is just so funny to me, looking back, how intimidated I was by my classmates. 14 of my classmates applied to residency, and we all got in, which is it's amazing. And so that tells you that you don't have to be number 1 or even number 2 in your class to be applying to the residency that you want to apply to. Just do your best, do what interests you, because whatever interests you is what you'll be passionate about. And so just try to be as well-rounded as you can, because that's what honestly I think makes you interesting. So so sorry I went through it pretty fast. Is there
No, that's okay. Yes, so Shalini will go through our Q&A from the YouTube live chat now.
Yeah, so we actually got quite a few questions for you. The first one was, how long did you work as a dental assistant?
Good question. I would say about a year. I remember doing it maybe in my, because I think I took the RP class maybe my 3rd year of college. And so by my 4th year, when you're mostly done with your classes, hopefully, you have more time to work as a dental assistant.
Right, that makes sense.
Mm-hmm.
And how was the balance between undergrad and vocational school or dental assisting?
Good question. I think, I really, gosh, it's been like a decade now. So it's hard to say, but I want to say, most of my first and second year, I remember taking like 15 to 20 units. And so by my third or fourth year, I think I had a lot of free time. And the vocational program was like maybe 2 hours a week, where it was like, 1 hour on a Tuesday night and a Thursday night. So for a semester, maybe 2. So it's very, very doable.
Okay. Do you mind illustrating in detail what exactly TMJ is?
So TMJ it's a complex. Oh, sorry. Oh, I'm so sorry. Sorry, I'm at my office. It's a complex disorder. It's either muscular or joint. Most of the time, it's muscular, meaning that you're like either like clenching your jaws throughout the night or even during the day unconsciously. And so imagine working out your arms for like 8 hours. Your arms are going to be sore. So same thing goes on with the muscles. And so if you're finding yourself clenching a lot, then it causes a lot of soreness and achiness. And funny story is during dental school, I got a lot of TMJ. I was just so stressed out during the day that at night, like I was clenching in the morning. And when I wake up, I would be like, oh my God, I'm so sore because it's just been clenching. And that was like just that period of my life that I ever had TMJ. And so, but that's like a whole other like, presentation that you need to get into. It's kind of hard to explain just, verbally.
Yeah, no, I think that made a lot more sense. And I think I know you mentioned that it was a little overwhelming for you in the beginning to see like all these smart students. So one question was, do you feel your class environment in dental school was overly competitive? And if yes, did that negatively or positively affect your performance?
I don't know, it's kind of hard to say. I had a lot of competitive, I don't know if UCLA is still considered really competitive, but back in the day, we had a lot of, I don't know if you guys still call them gunners, but like, like people who were like in class, like day and night, like over studying. And then you'd see that and you're like, oh my gosh, I'm not nearly studying as much as they are. And so it can either, depends on how you take it. I think at first I was just like, okay, fine, I'm not even gonna compete. So I'm just gonna do my own thing and not even like try to like to compete with them. I don't know. I never was a super competitive type. I'm kind of laid back, and so I think in the end I was just like, you know what? What's the harm in applying? There's so many programs and there's so many spots. So there's no harm in trying. So I'm so glad I did. I would totally regret not being an orthodontist now, but that was the main I take away for this PowerPoint is that just focus on yourself. There's always gonna be someone smarter than you. Always gonna be someone more like charismatic or whatever it is. Just do your own thing.
Right, that makes sense. How does the academic rigor of dental school compare with that of undergrad?
I think it's a lot more intense because with general chem in undergrad you took it for a whole year. Here in dental school they assume that you already took a whole year, so they can cram it into you for like a semester or a quarter even. And so while you have the time to really learn it, like really it does take multiple rounds of learning the same thing for you to really understand. And so of course after a year of learning GChem, you may get the gist of it. But once you relearn it again in dental school for the second time, then I think it really sticks. And so it's rigorous, but I think it's doable because you've already learned a lot of it already the first time.
Right. Okay. Did you ever want to specialize in anything else other than orthodontics?
No. it was either like deep general or it was gonna be ortho.
Mhm.
I never considered any other specialties.
Okay. What resources did you use to study for the DAT, and do you have any advice on any study habits?
I remember taking the Kaplan course. I don't know if that's still a
Yeah,
thing.
no, that's still around. Yeah.
Okay, so I did that course. I think it was really helpful. The PAT portion, just practice as many those practice tests as possible to really pick up your speed taking those tests, and just the way I studied was that I would go through a book and I would highlight things the first time. I did like I would, and that would be like months away. And then as I approached it, I would have from those highlighted notes, I would type out those notes to a more consolidated paper, and then I would from there I just kept condensing it more and more. So kind of like how you learn GChem the first year for the whole year in dental school, you'll learn it so you kept going over it over and over and over, and that's how I used to study. So
Okay.
I always pulled all-nighters, which is I don't recommend it at all.
Yeah, those are not fun.
Yeah.
This next question I think is related to one of the cases that you presented, but are lingual braces becoming more common? And out of curiosity, are they harder to floss since they're on the backside?
Good question. I think still to this day, not a lot of people know that lingual braces exist, and so I feel like if people knew that it existed, there would be more interest in it because especially as an adult, like you really don't want for work reasons or whatever, like you don't want to look like you're in braces, and so I think it's a great alternative to aligners. Though right now it's still kind of in its infancy where it can only correct limited problems, and so I wouldn't say there's certain things that I still wouldn't use Embrace for, but who knows, maybe in 5-10 years the appliance is much better where I can correct a lot more different malocclusions with it. As far as flossing, the really neat thing about Embrace, and let me see if I can go back to the slide. Okay, so Embrace actually has what we call like a looped wire. So it goes up and down, up and down. The purpose of it is so that you can actually floss through your teeth as if you didn't have braces. So unlike a traditional wire where it's just straight across, this one is actually curved down below the contact point so you can actually floss. I would say though that food does tend to get trapped around the wires and brackets, and so having a water pick would really help kind of flush out any plaque or food debris.
Okay, that's really interesting. Yeah, I didn't know much about lingual braces before either. How do you keep up with the new technology in orthodontics?
Great question. One of the best ways for me is just being a faculty at the program. Like they're constantly learning new, like they're doing research in the program itself, and just being around other orthodontists. Like sometimes in as a practice owner, it's really, I would say, usually in your practice, most you kind of discuss like treatment plans and things like that. And so to be in a school setting, or even nowadays, like the really nice thing is we have a lot of like Facebook groups and support from other orthodontists. And so I'm in quite a few of those, and that's how I kind of keep up with what's going on as far as like new technology and what other orthodontists are using.
Okay, another question was, I noticed in case 3, a tooth discoloration. What does a discoloration of a tooth mean, and how is it treated?
Discoloration, I don't know if you can, let me see if I can pull that up. Maybe, are you talking about maybe the yellowing of this tooth, or?
Yeah, that's what I'm assuming they were asking.
Sometimes a tooth there's many reasons why a tooth can be discolored. Sometimes the enamel is thinner on a certain, like especially on the lateral incisors, the enamel is thinner, so the dentin shows through. Or it could be that tooth is non-vital. But a lot of times when it's non-vital, means it tends to be more gray as it discolors, not more yellow. And so here it could be just maybe plaque, but it could also be like a thinner enamel.
Okay, thank you. And what are some things you did to de-stress during dental school?
I used to party a lot. So like as soon as finals was over, you could find me at the bar. So that's how I decompressed. But these days there's, you can exercise and travel and things like that too. But that was a quick and easy way for me to decompress.
Do you have any interview tips? I have my dentistry interview in just over a month, and I live in Canada, so I know the timing may be different than the US. This was a question from one of the students watching.
Interview tips for dental school? Gosh, my recommendation is to go to as many interviews as possible, even to the schools that you don't really want to get into, just for practice. I think that's a great way to interview well as at the school that you do want to get into. So I remember when I went to interview on the East Coast, I scheduled an interview for a school I didn't particularly care for first, and then I went to the one I liked more second. That way, at least I was a little bit more comfortable, less jitters and things like that. So as far as preparing for an interview, just practice talking to yourself in the mirror. Like some of them, there's always the more common interview questions like, oh, why do you want to get into dentistry? Where do you want to practice, and things like that. So you can kind of see yourself as the more you practice, the more you're comfortable you'll feel, and the more you're comfortable you'll sound and authentic.
Yeah, for sure. There was another question asking, is it difficult to stay up to date with new technology? I think you touched on this, but if you want to expand on that more.
I think definitely these days it's a lot easier. Before, like, internet, I think back in the days it used to be through your vendor rep or like at a conference. Now I'm just like, I feel like I'm constantly bombarded by new companies and things like that through the Facebook groups or I think it's much easier to stay on top of technology these days.
How are you able to go into private ownership so soon?
Good question. So the traditional route is typically, you find your senior doctor to associate under and to learn, to hone your clinical skills and learn the business side of orthodontics. Sometimes it's not always possible, like whether if maybe your area is more saturated or there's, more nowadays, more less practices, more like corporate dentistry. And so, sometimes you just have to take a leap of faith. Like, you've already gone through 10 years of residence or 10 years of school. And I always tell like anybody who's interested in being a practice owner, like I know sometimes you understand dentistry, but you don't understand business. But I say, people who had less education than you have started a business. People with high school diplomas have started a business. So yes, it's something to learn, but I bet it's not hard to learn. So you've already gone through so many years of school. I wouldn't be scared off by owning a business. I think that's something that as dentists, we have very stable professions, and it's very rare that a dental office goes under. And so just trust in that. And if you feel like, the associates just aren't there, then, just take that risk. If there's ever to take a risk, it's early on in your career. Don't wait till you're 55 to try to practice. Like there's going to be, trial and error. I would say maybe my first 2 years, I was just trying to keep things afloat. Like I wasn't trying to grow. I was just trying to figure things out and learn as much as I could. And again, with the internet, you can learn about anything. You can learn about how to, what taxes to pay and like, what permits you need. And so it's always figure outable. Like that's the best way I can describe it is. So yes, I wish I had somebody to associate under, but I think I did fine without one now, and I'm already working on my second practice, and so like take the risk. I think it's worthwhile.
What was your most rewarding favorite patient smile transformation that you have been able to do?
Gosh, there's so many. I love seeing like like young kids who are super shy to smile, and just see them like blossom or bloom under like, you know, my care. And that's the reason why I call my practice Bloom Orthodontics, is because I love to see that transformation. But there's so many off the top of my head, but it's just, that's the best part about my career, is to be able to give my patients that confidence.
Yeah, for sure. I can definitely imagine that.
Mm-hmm.
Someone else asked, do you take a lot of CE courses right now?
Oh yes, definitely, and it's so much easier now. Oh my gosh! So I have 2 young kids. I have a 1-year-old and a 3-year-old, and the last 3 years it's been nearly impossible for me to leave the house. And so to take a CE course is just so hard. And now everything is online. It's through Zoom, and so like, you know, I can easily take CE courses from home now, which is amazing.
Cool. And the last question was, could we connect you through email for further questions?
Oh yeah, for sure. You can definitely contact me. My email is info@bloomorthodontics.com. You can message me through my IG account. I'm pretty, what do you call it? Gosh, I'm like at the end of my day now. Like I can barely think.
No worries.
You can contact me. I'm very responsive. Thanks.
Great. Well, I think those were all the questions that we had in the chat. I wanted to ask one quick question and maybe give anybody else a chance to ask questions if they have any. So you mentioned that the braces that were by the lingual side were curved. Would it be possible for the ones that are like on the outside to be curved, or do they need to be straight?
That's a great question. The ones that are curved on the backside are like, again, it's customized wires. And so, I mean, I can't imagine why you wouldn't have on the buckle, but I mean, like, you know, on the front side, but I can't imagine that being very aesthetic. So, right. I mean, you could, but you would have to find a company who's willing to design that type of the braces.
That makes sense. I don't see any more questions in the chat, so I think we'll end our session here. But thank you so much, Dr. Vu, for that wonderful presentation and answering all of our questions. We really appreciate it.
It was really fun. I just, again, wanted to, I know sometimes this career path is really challenging, and you just run into all sorts of really, really, you know, people get kind of overwhelmed. I just encouraged or motivated you to just go ahead and pursue whatever it is that you want to pursue.
Definitely. Well, thank you so much again, Dr. Vu, and thank you to our audience for joining us tonight. And we hope to see you at our next virtual shadowing session. And I hope everyone has a great night. Bye, everyone.
Bye.